The DriveABLE Cognitive Assessment Tool, or DCAT, was developed from award-winning university research testing hundreds of cognitively impaired clients and healthy drivers. The research began comparing the performance on a wide variety of common neuropsychological and rehabilitation tests against actual in-car performance. A number of other, more complex tests were introduced because the research team thought they might be better predictors of driving. The researchers realized the advantages of computerized presentations while being sensitive to the need for simple visual presentation and tasks that are easily comprehended by a range of cognitively impaired clients. Clients respond by simply touching the screen or pushing a button. Here is an overview of the DCAT tasks and their relevance. Motor speed and control task. Driving sometimes requires quick responses to avoid dangerous situations. In the first task, the client holds down a button until a shape appears, unpredictably, on the left or the right side of the screen. When the shape appears, the client is to touch the shape quickly and accurately. Span of attentional field task. While we are attending to the road ahead, it is important that we are able to identify events, for example, traffic signs and pedestrians, that occur in the periphery. This task engages the client's attention at the center of the screen by asking them to make a decision about a briefly presented word and to identify the location of a simultaneously occurring target presented at different distances and directions from the center of the screen. Spatial judgment and decision-making task. Turns, merges, and crossing a stream of traffic are maneuvers associated with high crash rates. Complex judgments about the speed of oncoming traffic, the distance between cars, and the acceleration of the driver's own car are needed. This task measures relevant abilities by having the client make decisions about when it is safe to accelerate the box to move it between the lines. Speed of attentional shifting task. A driver often needs to engage and disengage attention. Disengagement of attention can be slowed when there is brain injury due to disease or trauma. In this task, the client's attention is either correctly or incorrectly focused while waiting for a target event. The ability of the client to refocus attention when the target event occurs is of primary importance. Executive function task. Driving is complex, requiring the coordination of different mental and physical activities. This coordination is often referred to as executive functions. In the first part of the task, the client simply tracks the locations of an X. The second part requires more extensive control of mental processes. Here, the client is instructed to touch not the X that just occurred, but the X that occurred one back. Identification of driving situations task. Identifying hazards and the actions needed to avoid a crash is clearly important for safe driving. In the final task, a set of short videos of real driving scenes is shown. For some videos, the client is to identify the dangerous situations. For other videos, the client is to identify the driving action that needs to be taken for safety or to avoid a crash. The client chooses the best answer from 4 alternatives. Scoring and reporting. Once the tasks have been completed, the evaluator simply touches the score icon. The client's encrypted performance data are sent via the internet to the DriveABLE server for scoring using the proprietary algorithms. The scored results are encrypted and instantly returned. The report contains normative scores for each task and an overall outcome measure of predicted probability of failing a road test. There is no question that DriveABLE has achieved the goal of developing a highly predictive assessment tool. In addition to research validation, a multi-center field test conducted in Florida further evaluated the predictive validity of the DCAT. Using the cutoff scores defined for the DCAT, a sensitivity of 93% and a specificity of 82% were achieved for predicting pass-or-fail road test performance of mildly impaired drivers, a remarkable outcome for a 30 to 40 minute test battery. The DCAT is a highly effective clinical tool enabling evidence-based decisions about cognitive fitness to drive.